So a lot of times people go to the doctor and they don't know what it is or give it some label, but it's not telling you what's actually causing the problem. And maybe the doctors don't know what to do about it and say, I don't know. Or they give a person a symptom suppressing drug, which may help, the symptoms, of course, but of course can have side effects and not really getting to the root of the problem. And if you don't get to the root of the problem and you just give symptom suppressing drugs, well, then that person is going to have to take those drugs for the rest of their lives, just to suppress the symptoms of something that they could have found out was quite simply a gluten intolerance or some sort of toxicity that's gotten stuck in their body that just requires a couple herbs to push out. So this is the benefit of nutritional analysis. It's very helpful for these kind of conditions that modern medicine simply doesn't know how to deal with. One of my first clients, was something I just gained confidence from because she was my first client. It worked out so well. She had had migraines for most of her life, really, and she was about 50 years old, and she started getting migraines when she was 12. So she's on a few different medications for migraines, some just preventatively, some when she actually gets the migraines, and she was getting them about 3 times a week. So I took a look and found out, okay, so migraines usually are a liver or gallbladder issue. Our modern medicine doesn't realize this. They think it's in the brain, but with nutritional analysis, it's invariably liver, gallbladder. Even with Chinese medicine, same thing. It talks about headaches being a liver and gallbladder issue. So sure enough, it was her liver that was blocked by mercury. And she had had dental amalgams in ever since she was a child. So those are the silver fillings that are made of half mercury. Those fillings leak over time. And that mercury just gets in the body and starts to go into different organs. In her case, it was especially her liver that it was going into and clogging it up. And basically, one common sign of a liver issue or a gallbladder issue is migraines. So once I found out, okay, it's mercury, I tested her on a few different herbal products and homeopathic products to find out which one would be the best to gently start getting this mercury out of her liver. And so I did that and put her on a specific herbal product. And even in a week, she felt much, much better. Her migraines started to reduce in intensity and frequency. And in a couple months, the migraines were gone. She no longer needed the intense medication that she was on that was barely working anyways. So that was a cut and dry case of someone who had had something for years and years. It was pretty simple using nutritional analysis to find out what it was, and then treat it. But for her, for modern medicine, it was something they couldn't figure it out. She had an expert neurologist and this and that, but they still, had no idea what it was from. So nutritional analysis is a method of testing the body to find out what are underlying issues behind health conditions. So I use a method called applied kinesiology, which many different kinds of practitioners use, but in my case, I'm looking specifically at what are the organs that are off in terms of a health issue. What are the key organs that are a little bit imbalanced, that are creating the health problem, and then from there, figuring out, okay, are there foods that a person is eating that is bugging this organ? Are there toxicities that are depressing the function of this organ? Is there yeast, parasites? All those kind of things that can really make an organ not work well. Mineral deficiencies, fatty acid deficiencies. And then from there, I use applied kinesiology to test for, what will help these organs? So many times it's avoiding maybe 1 or 2 certain foods, or it could be detoxing that organs using herbs or homeopathics or nutritional supplements, or supplementing the body for a little bit with certain minerals or vitamins, and in the meantime, having a person increase foods that are rich in those nutrients, and then problems can go away.